We thank you so much for being here today.
Thank you for having me.
There's been incredible momentum here. We hear positivity even in these incredible stories. Amity, thank you. And we have healthcare in the room, we have advocacy in the room, we have lawyers in the room, finance, social media, and we have entertainment in the room. So there we are. So we all have reasons to be here. And as an actor, an author, a mom, an advocate, tell us your why. Tell us why you're here with us.
So this is my why. It was December 14th, 2012. And I was working on a movie here in New York City, which is like my favorite thing to do because I live here. My children grew up here. I just always want to work at home. So I had this job in Queens. It took 20 minutes to get there. But it was December 14th, and my youngest child, who was 10 at the time, had already finished school. She'd finished for her Christmas vacation. My older child was in middle school, I think, and so his had a different vacation schedule. So I said, what I'm going to do, it's an easy job. I'm going to bring her to work today. And I wasn't called till the afternoon. And the news broke of the Sandy Hook massacre. And I thought, oh my God, what am I going to do? What am I going to do? I thought, well, I don't want to talk to her about it now. I don't want to scare her. I want to protect her. So when the van came to pick us up, I said, please turn the radio off. And we went in, and then we went into Harry Maker. I said, everybody, please, you heard the news. This is so devastating. I don't want her to be upset. Please just don't talk about what happened, and turn the televisions off. And everybody was really careful about her, and no one mentioned it. And I was really, really trying to protect her from this news. I thought, well, we'll talk about it when we go home, and her father is there, and her brother is there, and we can have a discussion as a family about this so that, we approach it properly. And we were waiting for them to come home and decorating our Christmas tree. And she looked at her very carefully monitored phone, which she shouldn't have had either at the age of 10, but she had an older brother, one where she could only talk to her grandparents, only a couple of friends, like only make emergency calls. And she looked at it and said, Mommy, did a bunch of little kids get shot today? And I was so ashamed of myself, because here I was this entire day trying to keep my child safe from the news, trying to protect her psyche. And I thought, I'm not doing anything. I'm not keeping her safe. I'm not keeping her brother safe. I'm, kind of shrouding myself in this kind of like secret world, and keeping her away from the news is not going to keep her safe at school from gun violence or any other child. And so that was the moment that I kind of started looking around, and I noticed that Mayor Bloomberg had started an organization called Mayors Against Illegal Guns, and I saw what Shannon Watts was doing with Moms Demand Action. And I also started speaking out about gun violence in the U.S. and noticed that a lot of my colleagues weren't speaking out about it. Traditionally, people in entertainment were fearful of that because they thought it would affect their careers. So then, after a couple of years of this, I realized that Moms Demand and Mayors Against Illegal Guns had become Everytown for Gun Safety. And I approached them and I said, what can I do to bring my community to this organization in order to advocate, in order to amplify what you're doing? And so that's when I just sent messages to everybody I knew saying, are you willing to speak about this issue? You don't have to show up to anything. Just say you'll tweet. Just say you're in support of it, whatever. And that sort of began what we call the Creative Council, which is people in my community who are willing to speak about gun safety.
It often starts with our children and how we think about this, and we certainly can't even protect our children from social media, that's for sure. But obviously we're all in this room because we can't protect our children from gun violence.
No. And as Shannon Watts, said, if you've lost your children, you have nothing left to lose.
And we can all agree with that. We saw the ad council agree to agree. We all agree, and we sit here incensed as you were that day, that it's an absurdity that we still sit here saying we all know the data. So I commend you for getting out there, but we've talked a little bit about the entertainment industry, how not so much necessarily do people listen to you, but what has your work been like? What is the work that you do at rallies? Is it communication? How do you envision that?
It really is mostly amplification and communication. As we were talking about backstage, traditionally people do not want to listen to actors, and I don't blame them, right? I mean, we're not authorities, we're communicators, but they like to listen. They would listen to law enforcement, They'll listen to people in healthcare. They'll listen to people who are veterans. So it's like, how do you amplify those messages? That's why I was delighted to be here today, because it's like people will listen to a doctor. You're experts, right? So a lot of the work that we do is about, well, for example, every town always had this kind of convention called Gun Sense University, where all these volunteers would go and be kind of trained in advocacy work. And we would come often and talk to survivors and amplify their stories and talk to volunteers and just be there as support. I had an interesting experience, talking about a survivor. A woman who was my age on the first day of the convention came up to me and said, "Thank you so much for being here, for doing the work that you're doing."
Yeah.
She said, "I just wanted to say hello." The second day, she came up to me. She goes, "I'm a volunteer. I've been doing this for years." The second day, she came up to me and said, "I just want to let you know, I'm not just a volunteer. I'm also a survivor." And I said, "Oh, okay." And then she ran away again. And the third day, she came back and she said, I didn't tell you my story.
Right.
I really want to tell you my story." And it was heartbreaking. She said, "My son had mental health issues. He was 18 years old. He called me and his dad. He was going to school in Texas. We knew he was in trouble. We got in the car. We drove down there. By the time we got there, he'd walked across the street, bought a gun, and killed himself."
Yeah.
So that's a story she told me. It was incredibly moving. It took her 3 days to get that story out.
That's right.
But then that's a story that I can amplify.
Right.
Right?
And we have heard so many stories, and you're a storyteller in yourself. And it's how we use these stories that does amplify the message. Right. I mean, last night we start our dinner and we go around and everybody has a story as to the why. Yeah. I do just want to call out Oressa. You told your story about your son and was incredibly potent because you said the doctor walked away. And I said, we don't walk away. And that's why every one of us in the room, we don't walk away. We've been allowed to be here. So how can the entertainment do this more? Do you get pushback? Are you getting your colleagues to do this? Where does this stand?
We don't get pushback. I mean, it's interesting because every town does work too in writers' rooms where they go and they say like, "Hey, we'd like to suggest that you show officers putting their guns in a lockbox." Mm-hmm. We want to see kind of general gun safety practices in television shows and in movies. I played a character in a con movie, and a gun shows up at the very end of the movie. And there was a lot of kind of speculation about like how many guns there would be. And I was like, no, one gun and one scary gun. And I said, and the way I handle the gun is like this. I said, this is a person who's a con artist. She doesn't know how to hold a gun and she doesn't want to hold a gun.
Right.
I said, so we indicate and that this is dangerous, that she's not a professional, that there are mistakes made. It's like, where can we communicate those messages? It's not so easy. It's dangerous. We talk a lot about in media about like, what is it that you show? Sometimes you show someone dies in a TV show and it's like this, like nothing happened. It's like, no, they would be eviscerated,
right.
So it's like, so I do think that there's movement within the entertainment industry to reflect these changes. That being said, I don't think that entertainment changes the world. I think it reflects the changes that are happening in the world.
Right.
So I think because there is a cultural movement afoot, that there are so many people in this room and there's so many people who care about these issues, it is beginning to be reflected more in our entertainment. Also, no, this is an important thing too. The entire world consumes the same entertainment that we do. Right. The same movies, TV shows, video games. We're the only nation of this size that has this kind of gun violence problem because of our easy access to weapons and our lack of legislation around gun laws.
So And I think that's what ends up being so frustrating. We actually know what we can do, so we sit here frustrated. I've also heard you say that gun violence prevention is a public health issue. It is obviously, and we've heard that multiple times. Now, we say that. We take this on as a healthcare industry as health, the health of our communities. We talked about what can we do in the communities, our jobs, our entertainment, our restaurants. It's not only legislation, it's not just advocacy, it's improving the communities. But we were told to stay in our lane.
Isn't it is our lane.
This is our lane, right.
We're human beings.
Right, this is
You
our
know,
lane.
that's the thing. That's what people always talk to me like as an entertainer, as an actor, what brought me here. I'm like, I didn't come as an entertainer. I came as a
Human being,
parent.
right, as a human
I'm
being.
a parent.
Right.
I had an actress say to me, don't you worry about this work that you're doing, that you'll be a target, that you'll be shot. And I was like, the odds of my being shot are the same as any, and you're just walking down the street. That's where we are with that. So I'm a human being. The number one cause of gun deaths is suicide. People don't, you have all these mass shootings and random shootings, and people think that that's where most of the deaths occur. It's like, no, it's suicide, and also often suicide among veterans. So it's like talking about doctors, psychiatrists, and people with suicidal ideation. Do they say, do you have a gun in the house?
Right. And that's why we so much talk about gun safety, and that's certainly where we have come about, and we've done a lot of work in that area. And how do we get the rest of the world to talk about this as a public health issue? And it's not political. We started with Chris Christie, who was remarkable today, and he set us straight. There's ways of doing it. How do we continue to talk this way, that it's public health and a crisis?
Well, it is a polycrisis, right? So that's the problem.
Right.
It's like whack-a-mole. Every time you talk about, access to weapons, somebody talks about mental health, and then they talk about, school shootings, and they talk about safety at schools, and so you kind of go everywhere. But I think where you start, for me anyway, I grew up, I'm old enough to remember the campaign about don't keep Drano under the sink.
Right.
Right? So it was like everybody had all their chemicals to clean with, and it was under the sink. And then there would be these articles in the news saying another baby burned themselves by putting the Drano on their lips. Huge campaign and public health campaign.
Right.
Keep things up high where children can't get them. So it's, once again, it's that common sense idea. It's like you have a constitutional right to own a gun, right? We know that. So, but you have a responsibility to do it safely, with certain kind of responsibilities in place. So how do we talk about that? How do you, in a pediatrician's office, you say, like, when your child goes on a play date,
Right.
Is there a gun in the house? Do you know, is there a gun in the house? Is there a lockbox in the house? Is there someone present? Is someone, all of those things. But we were talking about this backstage too. You used to go to the doctor, no one ever asked you how much you drank. Right? No one even thought it was a problem. So now,
And everybody lies anyway.
yeah. But now they ask you, so now people ask you. So it's like, how do you normalize all of those things? How do you say, like, this is an issue. We are going to talk about it. I am going to bring it up. I can bring it up in my work and say, like, no, there wouldn't be more than one. No, she wouldn't know how to hold it. A doctor can say, if you have a gun, do you have a license for it? Do you have a lockbox? A lot of people don't understand about concealed carry reciprocity. That's a law. That's a really dangerous issue right now. That you can have you might have a permit for concealed carry in one state, but another state's not going to require it. So you can go from a place where you don't require it to another one, and just suddenly there's somebody with a gun who doesn't have a permit in your town because your state hasn't legislated that. So legislation is so important.
Legislation certainly is key, and we've heard this in this room today, and certainly we've heard on this room people are comfortable saying, and we heard Ramon say this, my child has an allergy or they can't do this, but we haven't had the comfort yet of saying, do you have guns in the house and have they been kept safe? And we have to get comfortable doing that. What more can stories do for us? What more can the entertainment industry do? We have heard the award season. Everybody's up there saying what we can do that. Where are our voices going to be the most helpful?
As I said, I don't know how helpful we are. I think that amplifying the voices of people who are helpful, that's what's most important for us to do. I think people who are public safety experts, I think people who work in gun violence prevention, any Erica over there. I think people who, healthcare people, veterans. Every town has a wonderful program where somebody earlier was talking about an NRA gun safety program, and often in those programs people are gun extremists. So every town has started this gun safety training program with veterans to train people about how to handle a weapon properly. So, how do you, who do you go to? Law enforcement. Law enforcement, people who are on the streets and seeing this all the time. How do how do we in my community amplify that? That's sort of what I've asked my peers to do, is to offer support and amplification to experts, and not to be afraid to talk about it.
Right.
Not to say this is an issue and I care about it as a parent and as a human being.
And we have to take this momentum, because we talk about it in this room, but we have to talk about it everywhere, just like we've talked about every public health crisis and how the crossover is as well. We've heard a lot of stories, and they're always hard to hear, but yet we also end with optimism. And so what are some of the things that you are optimistic about? And how can we heard Amity, who comes across with a glow and with an optimism that gets us all charged out about wanting to go out there and not stop. What makes you optimistic?
The thing that makes me most optimistic, one of the programs that every town has been running is how to train women to run for office. So people come in to Mom's Demand, and they're very activated by the issue, and they're interested in how they can move the needle in their community, and every town teaches them how to run. And they run for school boards, and they run for other local elections, and they run at the state level, and they run at the national level, and they win. They win. So those are the kind of people, they're issue-driven people. It's interesting because you talk often, and the people always talk about being single-issue voters. That's sort of an interesting thing. It's like as if there's like one thing and the rest of the stuff is like, well, whatever, But I feel excited by these women who are winning these seats, because this is their issue.
Right.
This is their issue, and it's a huge issue. It's not, and also to understand that it's a financial one too.
Right.
The reason this has gotten so out of hand is these are gun manufacturers who are trying to sell more and more and more and more.
And I think that we have to make those partnerships that we've heard in this room. And I think what I'm most optimistic about is that we are in this room together, crossing across disciplines, everybody having a voice, and not stopping and moving it forward. So what would you like to leave us with today, your final thoughts in terms of how we move forward and why you're involved and staying involved, and how do we keep our energy going forward?
I think that, listen, this is a really silly little kind of thing to end on, but I think about as an actor, also growing up, given my age, the poison under the sink, whatever, standing up in the back seat of my car with my arms around my dad's neck while he drove, right? That's what I did.
Right.
And I'd sing in his ear and do whatever, Seatbelts, who had a seatbelt? Right? So it's changed so that you would not even think of getting into a car without putting your seatbelt on. It wouldn't even occur to you.
Right.
There was a time when I was doing movies too. It's like, okay, run, it's the run, get into the car, jump in. And you'd be like, I have to put my seatbelt on. And the director would say, no, you don't have to put and you'd go, no, I have to put my seatbelt on, right?
Right, exactly.
So the culture changed.
Right.
The culture changed around that. We were able to do that. That was simple data. It was like when life is not safe. Life is not 100% safe, but we do understand that by putting on a seatbelt and picking up the poison and putting it on the top shelf, like how do we mitigate things? So I really believe it can happen. I also grew up at a time when I grew up in the Army, and my father was a hunter. People understood common sense gun safety. It's before the gun industry took hold of this and started kind of running with it and selling ammunition and selling automatic weapons. And so I believe it's possible. I really do, because it's happened before with other issues. And seeing everybody in this room, all of the healthcare professionals, all the survivors, all the people who work in gun violence prevention. I mean, I know these people, and I've watched the group get bigger and bigger and bigger. So I believe that we can change it.
You heard it from Julianne Moore. She believes it. I believe it. Everyone believes in this room. If we just make gun safety part of what we do every day, we have to bend that curve and we have to change it. And we are here in this room to do that. So thank you for lending your voice. Thank you for being with us today. It's been an honor. Thank you.